All right, everyone. Good morning. I'm Sarah, and hello to all of you out there all across the state of Montana. We're really excited that you've all joined us today for this No Child Home Alone Summit. This has been put together for all of you by the Montana VOAD Subcommittee on Child Care. It is
sorry about the racket background. I'm supposed to.
and so we are ready to go. Before I even get into anything, we'll start with just the few basics of Zoom meeting how-tos and requests, since that will make all of our meeting more pleasant. So you can see your controls. All of you, I'm sure by now in this pandemic world, are used to Zoom meetings, but just for the sake of review, if you hover over your screen, all your controls show up at the bottom of your screen. If you hover your mouse, you can chat, control your audio, video, use all your Zoom features, including your mute. So we can mute you, but if you keep yourself muted when you're not talking, that'll make it a lot easier for everyone to hear. If you're willing to turn on your video and close other windows, give us your attention for just 2 hours. We're really hoping to get a lot from you, as well as provide information. So as much as people can, focus in on us for a couple hours. We would really appreciate it. This is an issue, I think, that's pretty important facing our state, and we're really looking forward to being able to have a meaningful dialogue between the VOAD subcommittee and all of the rest of you who've joined this summit today. So, like I said, if you can turn on your video and close your other windows, it would be much appreciated. You joined with your camera off and audio muted, so you will have to turn your video on, and if you want to speak, you're going to have to unmute yourself. We'll try to remind you if we see you talking silently. If you want to speak, there are going to be opportunities where folks are asked for input, as well as breakout groups, but there's a little participant button at the bottom of your screen. If you click on participants, you'll have a raise your hand button, and if you raise your hand, then we can take folks' comments when the time is right, and we'll know who wants to speak. So if you would also just take a moment, if you haven't already, to rename yourself on your screen so that folks know who you are when you join small groups and or speak. It's pretty easy to do. You have to click on your name, your little picture, and there's 3 little dots up on your right of your picture, and if you click into those, there's an option to rename yourself. I think that was on the first welcome screen as well. So we're also asking if you would chat your name, organization, position into the chat box. Plenty of folks registered, but those fields weren't required, so we're hoping to know who we have moving forward, who participated and who was on the summit. We obviously welcome your feedback. Type in your questions, comments, whatever you want. Use that everyone option on your chat feature so you can see what other folks write and they can keep track as well. If you do need help, you can always message privately Bree or Stephanie at HMHB, and they can help you out. This presentation is being recorded, so we will make it available and send out the information after the meeting so that you guys all have the slides and the shared notes and the recording link as well. So with that, Amber, let's move the slides forward. Welcome. Okay, I'm your facilitator. Keep right on going. We have a packed agenda. So our goals today for this group are really to take some time to hear from folks, as well as some survey results to understand the problems facing childcare and out of school time care from the experts in the field across the state. We are also, like I said, hoping that everyone will engage in terms of providing us with your questions, concerns, any emerging strategies. We have a collective commitment that we are looking to solve this childcare problem together. I don't think there's any other way that Montana can solve it. I think when you look at this agenda, you see different childcare systems that often you don't see presenting together in terms of 0 to 5 and then school age, but this is a problem that requires collective commitment and collaboration and communities coming together for our children. And I really think that that's what we're looking for today from you to help us define potential next steps as to how we move forward. When we were preparing for this meeting, I think that a lot of discussion about the values came up, so we just wanted to address them right on. We know the environment is changing fast. We know that we have no certainty around what we can plan for, so it's important to remain flexible. It's important to remain nimble and very open-minded. We can't solve this problem alone. Everyone who's joining us today has a role to play in planning to care for our kids. We would say that we probably recognize that a large majority of you are working from home with kids. So if that's you and you're willing to, admit it, we'd love to know how many of you that is, because obviously this is an issue that impacts a wide variety of people in all settings and scenarios with children. And we understand this is a difficult topic and acknowledge that, some of the things we're going to talk about today can be hard. There have been some community meetings focused on this, and we've gotten some feedback that thinking about these issues and kids home alone and some of the staggering sort of statistics about, when the economy goes down, child abuse and neglect goes up, and what we're really doing here today is watching out for kids and making sure they're safe and their needs are met. But sometimes that can be hard, and so we acknowledge that. All right. Our agenda is packed, so please be thinking about these things as we sort of race through our presentations, pause for feedback, and then go to breakout rooms. But we're going to ask you at the end, if you're willing, to give us your thoughts on what did you most want to share, what matters most to you, what are you going to walk away with, and what solutions really intrigue you and why. So be thinking about those things as we proceed through these presentations and then feedback and small group discussion. Like I said, it's going to be fast, but I will do my best to keep all of you on schedule and on agenda, and we will end on time. So first, I want to welcome our speaker from the Red Cross, who can talk a little bit about what is the Montana VOAD and the subcommittee on childcare that has brought this summit to you, and that would be Abra Furman. So Abra, if you are out there, I'm going to turn this over to you.
Sarah, if Abra is not out there, I'd be happy to share a little bit.
Well, sure. Our first flexible presentation. That'd be great. Thank you, Megan.
Sure. So hi, everyone. My name is Megan Ballinger, and I'm the Network Director of the Montana Childcare Resource Referral Network. We are also a VOAD member, and so that is where I was first introduced to many of these partners that we've been working on the childcare subcommittee. So it's my pleasure to facilitate the childcare subcommittee meeting each week. So Montana VOAD stands for Voluntary Organizations Active in Disaster. The VOAD is a statewide collaboration informed by community organizations active in disaster, or COADs, across the state. Let's see, as VOAD increased the frequency of meetings to determine the needs and solutions to COVID-19, it became clear of the pandemic's effects on schools, businesses, and childcare businesses. And posed a significant impact on the accessibility and affordability of childcare for Montana families. Children aged birth through 9 years old comprise about 11% of Montana's population. The Montana VOAD Childcare Subcommittee recognizes children have unique needs during a disaster that require specific recognition and coordination from multi-sector partners. This subcommittee is collaborating to support solutions to move our economy forward, safe care for our children, and professional support for our educators. This is not a problem only one organization can tackle. Together, we are leading with empathy, passion, data, and expertise to solve these problems.
Thank you, Megan, for jumping in. So we thank the VOAD as well today for putting together this summit. And we're going to start first then with Amber Caldwell, who's going to present some of the results of the Enhanced Survey, Essential Childcare Needs, COVID and Beyond. So Go ahead, Amber.
Hi, everyone. So Enhance is a project that came out of the Montana VOAD with the intention of serving families, parents, child care providers, schools, and businesses to try to get a handle on the cascading effects of COVID and the impact it's had on these different verticals. We surveyed folks across all 4 categories. Again, that's parents, child care providers, businesses, and schools. About 3 weeks ago, we launched the survey and we just closed it on Sunday evening. We had 1,735 respondents, and the slide shows the breakdown of by type. We mainly had a lot of families respond, providers, businesses, and schools. And I think it's important to note we have 1,200 surveys in progress. So by the end of this week, we will have a final total of close to 3,000 hopefully completed surveys. What I'm going to show you is a few highlights from the responses that we've analyzed so far. And as you can see, this even right now is a breakdown across the whole state. So it's a pretty good representation of the current state that COVID has had on families, providers, businesses, and schools. What we know so far is that 69.2% of families have had a negative employment impact due to COVID. That means families have either experienced furloughed, fired, laid off, reduced pay, reduced hours, or they've shifted to work from home. And this has impacted their ability to take care of their children. 92% of families have had the same or greater childcare needs due to COVID. This is the breakdown of childcare needs by age. So combined of 0 to 5 is close to half of the respondents. And it's important to note 129 children with special needs were profiled in the survey. Only 72% of families can currently afford childcare. We asked a lot of questions around affordability, and I'm looking forward to sharing more details about that as we break down the analysis of the survey. What's important to note is the stability of childcare providers across the state. And what was concerning to me in looking at the preliminary results was that more than a quarter of care providers, roughly 28%, have expressed a concern of permanent closure within the next 6 months. And we identified care providers across a spectrum of types. The survey results in more detail will break down the specifics of how specific types of childcare providers have been impacted by COVID. There's been a pretty good use of the relief access offered by the federal government and the state, with the majority of the use across grants and relief packages that are forgivable, with some loans accessed by childcare providers and businesses. And what this tells us is that some of the relief packages have been used. There's been pretty good dissemination of that access. Yet there's been a significant monetary loss. So what we asked was, if you were to calculate the cost of COVID for your organization, business, school, what would that dollar amount be? The average loss for providers was $34,000. That was profiled only on 136 providers, with the highest loss of a childcare provider being $1 million. Businesses and schools experienced well over $250,000 average loss, with the highest business loss of $7 million and the highest school loss of $2 million. So this survey is going to give us a lot of opportunities to learn more about the social and economic impact of COVID. It's going to help us as a VOAD group, as well as a community, prioritize future needs, not just what we need now, but what we're going to need down the line. It's going to identify best practices across the respondents and prepare for readiness for reopening, whatever that may be. It's also identified areas where toolkit resources can be developed. So the next steps are really to disseminate this information in its entirety. We have a website, enhancemt.org, and on that website, we will be sharing when we're going to be presenting a webinar with all of the details. The reports will be on the website, as well as testimonials, best practices, the network, toolkit resources. And this is the website. We'll plug it again towards the end of the webinar. But again, everybody on this call will get the invitation for when we will be presenting those full results, as well as have all the downloadable content. So I thank you for letting me share some of these early results with a quick turnaround, and I hope it sheds some light into what we're finding across the state.
Thanks, Amber. All right. And in keeping things moving along, we're next going to hear from Megan Ballinger from the Montana Child Care Resource and Referral Network, who's going to talk about childcare in this COVID age.
Thanks,
Thanks,
Sarah.
Megan.
There we go. Thanks, Amber. So a little bit about us. The network unites the 7 child care resource and referral agencies across the state to coordinate efforts to build high quality, accessible early childhood care and education system that supports young children, parents, early childhood professionals, and member organizations. The regional resource and referral agencies, they provide required training and supports for licensed and registered child care programs and support families by administering the Best Beginnings Child Care Scholarship and by referring families to quality child care. So as Sarah said, my task today is to share with you what the impacts of COVID-19 have had on that system. Our state, not to mention our country's reliance on childcare, has never been more clear, evidenced in part by your participation in today's summit. In response to Governor Bullock's April 1st directive designating childcare as an essential service, childcare and education providers responded, in my opinion, heroic proportions by implementing safety precautions and increased sanitation procedures in order to continue to care for children of essential service employees during the stay-at-home order and afterwards as families return to work. With this declaration, Governor Bullock recognized the state's inability to effectively respond to the COVID-19 pandemic if healthcare providers, first responders, and other Montanians performing essential functions were unable to work because they were at home caring for their young children. Despite the critical role supporting our communities during this pandemic, childcare businesses have never been more at risk. Next slide, Amber, thanks. I'm going to spare you a little bit of my soapbox, but for context, I think it is important to understand 2 aspects of the early care and education system. First, these are small businesses we are talking about. And as national and statewide conversations discuss how to save small businesses, childcare businesses must be included in those conversations. The second aspect important to understand is childcare business model was broken long before COVID-19. Per senior economist Amy Watson, childcare in Montana is more affordable than in other states, but is still too expensive for many families. On average, Montana families will pay between $8,000 and $9,000 for childcare for a single child. For families at the median, that will account to about 11 to 13% of family income. A family with both an infant and a toddler in childcare will pay an average of $17,000 per year, roughly 25% of the state's median family income. So childcare can very quickly become the largest monthly expense that families can face. Yet, at the median, early childhood teachers who we've deemed as essential workers at this point only earn about $9.84 per hour, which translates to about $20,460 a year when working full-time. So why do early childhood teachers earn so little? Sorry, back a little bit, Amber, thanks. So why do early childhood teachers earn so little when parents are paying so much? There's a flaw in our system. Childcare exists in a market-based system. With the state subsidy program, the Best Beginnings Child Care Scholarship, only reaching about 25% of eligible families, childcare is financed primarily by private paying families. However, market rates do not reflect the true cost of providing high quality childcare or the increased costs that have been associated with COVID-19. They reflect what families can afford to pay. Childcare businesses often absorb that difference between the actual cost of care and what the market can pay. This is reflected in their low salaries, razor-thin margins, and minimal, if any, financial reserves. Early on, way early on in the pandemic, the National Association for the Education of Young Children conducted a national survey where 58% of Montana respondents indicated they would be unable to survive a closure lasting 2 weeks or more, which is the required time of a quarantine should a child or staff member test positive for the coronavirus. Next slide. So in order for childcare programs to be financially sustainable, they must live by what is called the Iron Triangle. They must strive for full enrollment every day, collect tuition on time and in full, and match annual revenue to expenses. So since the pandemic, nearly every childcare program in Montana has had at least one, if not all three of these elements at risk. Childcare businesses operate with thin margins, and even 1 month of missed income or unexpected decrease in enrollment can be catastrophic. Even before the pandemic, our state's childcare infrastructure was struggling to meet the needs of Montana's families. Less than half, or about 44% of Montana children needing care could be served by the pre-pandemic early care and education capacity. Children needing care in this context is defined as a child under 6 with all parents in the workforce. So we were already at a little bit of a crisis place. But it does thrill me to tell you that currently we've only lost a few licensed programs, and we've gained a few new programs since the beginning of the pandemic. But we're not out of the woods yet. Childcare availability has always varied across the state, and while some programs are at full enrollment, many Montana childcare programs are reporting up to a 55% reduction in enrollment currently, either as a result of safety precaution or parent choice. So parents are understandably cautious of group childcare right now, and many, if they're able to, are choosing to keep their young children at home. Regardless, with decreased enrollment, we are concerned that childcare businesses will not be able to sustain their operations. And when families are ready to return, or when health officials dictate it's safe to care for larger groups, those businesses will no longer exist. So in addition to that reduced enrollment, the one part of that Iron Triangle, childcare businesses are also experiencing greater than normal expenses in order to implement the safety precautions and the increased sanitation procedures. Who among us didn't struggle finding toilet paper, cleaning supplies, hand sanitizer during the early weeks of the pandemic? So we can only imagine what happened for childcare providers who are trying to provide those supplies in even a greater quantity than we use for our own personal uses. Cost of cleaning supplies not only doubled, but so did the amount of supplies that must be used every day, not to mention the increased staff time that's required to implement the increased sanitation procedures. Finally, as school districts moved to distance learning earlier this spring, many families did utilize childcare programs to care for their school-age children so that parents could continue to go to work. While many childcare educators are experienced at caring for older children, supporting school-age children with online schoolwork requires an increased one-on-one support, altering that normal day-to-day programming. In anticipation of the potential for reduced class time for school-age children this fall, childcare educators face restructuring their programs in order to meet the needs of families they serve. So to close out my section, as our state looks to make decisions about economic recovery, our success really depends on including childcare as a critical component of our plans to meet the changing needs of children's, families, and employers. Thank you.
And thanks, Megan. Next, we're going to hear from Lori Bishop, who's going to talk a little bit about the out-of-school time care and school systems and their response to COVID-19 and how they provide childcare. So, Lori, turn it over to you.
Thanks, Sarah. Hey, I'm Lori Bishop. I'm the director for the Montana After School Alliance. And I think in a space like this, it's important to say I'm also a state legislator, but that's not the hat that I'm wearing today. I really am representing the Alliance, and we're an after-school network joined by other after-school networks across the country. And we all have really similar shared goals to really focus on the data that's relevant to our sector, think about program quality, provide professional development and technical assistance to our field, and also work on policy. And in Montana, the Montana After School Alliance work is led by a statewide steering council. It's made up of programs and partners in our field from across the state, and many of them are actually on the call today. So we, in our work, are really addressing that part of who's serving kids that are hitting the school-age children, who we know really actually spend 80% of a given time over the normal year not sitting in a school classroom. And so this is all of those different kinds of programs, and we think about it pretty expansively normally. So we're including things like libraries and 4-H. For the purpose of today, we're going to focus in a little bit more narrowly just to really focus on those programs and partners who have the most utility to be a part of the ongoing programming hitting kids for several days a week throughout the year. So by our data, and we have a statewide database that we maintain, we have over 200 after school and summer programs that are providing ongoing regular programming to youth from pre-K through 12th grade. And we estimate that's about 40,000 students in the state who are able to receive regular access to programming. And it's school and community-based. So we'll talk about a couple of different funding streams today and how that impacts things. But even some of our community-based partners are working directly with schools to provide programming at their site. And then they're looking at how to meet those needs in the community as well. So you'll hear from Boys and Girls Clubs and YMCAs and Parks and Recreation, and also places like museums that have have some expertise working with youth and can be really critical partners at this time. Next slide, please. So I wanted to give you just a little bit of a sort of overview of how this sector is funded and how that's relevant as we look at the responses over the last few months and looking into the near future as well. And I wanted to focus in particular on how we think about the access for low-income families, even though these sorts of supports obviously help to build an infrastructure available for all families. So the only dedicated source of public funding in the state is the 21st Century Community Learning Center grant. This is a federal grant out of the Department of Education that comes into the Office of Public Instruction and is granted out across the state through a competitive grant-making process. And during COVID-19, this funding remains sustainable, it's stable, continuing to flow, and there's also been some flexibility that's been attached to it so that programs could respond at this time. And actually, I really want to lift up at OPI that working with our partners across the country, we really appreciated the fact that Montana was one of the most progressive states, and really making sure that flexibility was expressed as early as possible, and really worked with programs to figure out how they could proceed, particularly in this last school year. So a lot of our programs went to virtual programming. They worked with the school district and other partners to get materials out and distributed to families. They did things like food planning and helping with that. And they were able to do professional development and program planning and supports as well. And then as we look into the other part of the public funding that flows, it's not dedicated to school age, but it's an important aspect. And in other states, it plays a much bigger role. That is the CCDF funds that are flowing and are funding the Best Beginning scholarships for low-income families. In order for families to tap those, they can be available for children up to age 5, but they have to enroll their children in a licensed program. And currently in the state, we only have 5 that are providing dedicated school-age care and are also licensed and able to take those. And some of those programs are on the call today. And so we are working with the department to be able to open up possibilities in the future to potentially make it a little bit easier path for school-age programs to become licensed and to work with low-income families to utilize that support. But also during COVID, it is these dollars that are flowing for childcare that have been made flexible, and our sector is able to access and is playing an important role. So you see that around things like propping up emergency childcare centers, as well as being able to support some of the other programming that's happening. So it's it's going to play an important role during COVID, and that's really welcomed and appreciated. The other piece that's big is grants, parent fees, community support. But that really, we all know, just like any other sector, it's a little unreliable at this time. Programs have struggled trying to figure out how to put together appropriate fee structures for parents when they're not sure what the sustainability will be. But we, as you've seen noted, our internal data also shows that our programs have really done a pretty good job of accessing funding that's been made available through the CARES Act on their own. And we also know that some of the school funding that has been directed through the CARES Act can be utilized to help support out of school time. Next slide. So finally, I just want to quickly frame what's possible and how the out-of-school time sector can be utilized as we begin to look into the future and envision how we really meet the needs of kids and families. You know, our sector is really key to keeping kids connected and learning. So that's leveraging the existing relationships that they have with kids and families. And also they can really be a part of the solution and the outreach that can help to reach those families that might be a little harder to reach, and sort of pushing the bandwidth of schools. And also, you know, we think it's important in the out-of-school time sector, we really are often thinking about that whole child. We're important partners with the academic process and academic success, but we do that by first focusing on the socio-emotional needs of kids, thinking about those trauma-informed practices and care, and really engaging them in opportunities to have success that are a little harder to do within the constraints of the school day. And so being able to utilize those approaches and supports as we really help kids come through this sort of traumatic experience is an important piece of that, and we consider ourselves important partners. And then also, as we continue to think about how we make up ground for kids that might have been lost academically over the last few months and that we know could still be challenging in the coming year, after school programs can be an important partner for that. Then as we look forward to just trying to figure out the logistics of where are kids going to be and how will they be supported going into this school year, out-of-school time programs can really partner with the schools to address that need. And we want to shine a special light on thinking about the workforce in the out-of-school time, where we've got an experienced workforce that we share with the school day, but a lot of our community-based partners have staff that is dedicated to the out-of-school time space. And so as we look at just doing some hybrid solutions and where out-of-school time can be a partner, they have a dedicated staff that isn't also in the school day, and so can really be a part of that, and may play a unique role where we might have things like programs that don't do the ongoing programming but are experts and ready to go in this space and can really be a part of the solution. And then lastly, out-of-school time, just like the school day, is really thinking about the safety for kids directly in response to COVID and how to be a part of the solutions that can keep kids and communities and staff safe. But they also are thinking about that basic safety need that they're always concerned, and we're all always concerned with, which is thinking about safety from abuse and neglect, and really focusing on the socio-emotional safety of their youth. So they want to be important partners in being able to be a part of that safety net that is really supporting kids and families. I'll turn it over. Thanks.
All right, so we wanted to provide you a couple of examples of solutions that come from communities that have been part of this VOAD subcommittee on childcare. And so we have Grace Decker and Sarah Crum from 0 to 5 Missoula and Greater Gallatin United Way, who are going to talk a little bit about what has happened in their communities.
I'm going to speak for Grace, but both of us will be available if you have any questions afterwards on what specific solutions look like in your community. I wish we had a copy and paste solution, but every solution is going to be different for each school district and family, and that's something you're already aware of. But what we're finding are some patterns that begin to emerge, at least for us, into principal solutions that could be carried out throughout the state. When in the spring, what we found was that there's no backup infrastructure to provide care for school-age children during the day when schools are usually in session. And so when the schools closures happened in the spring, we had to create new infrastructure. For Missoula and Gallatin counties, we established emergency childcare, like many others across the state within the local COAD, the Community Organizations Active in Disasters. And these teams collaborated with schools and staffing and philanthropic resources and grants to ensure those essential workers have consistent and safe childcare. The most important piece with any of these solutions that you need to walk away with today is that coordination is key for every community. There are three pieces for us that stand out in making these solutions that we'll talk about in a little bit, or that frame it, and it's equity, effective use of resources, and public health outcomes. For us, the equity piece is understanding that there will always be kids that need care Monday through Friday, 8 to 10 hours a day in any of the phases that we go through, whether it's foster kids, first responders, those essential grocery store workers, or city county employees like hospital staff, and of course teachers. And all of them have a variety of incomes and ability to pay. And it goes without saying, but I'm going to say it, without access to this care, those frontline workers are faced with a choice to either do their jobs or leave their kids home alone. And that's one of the reasons why we're here, is we're seeing an increase in kids that are home alone. And so it's important that we create these systems with this community need at the base and build up from there. So you need to ask yourself, who are the kids in our community who need care during a shutdown or phase one? How can we provide consistent care to them throughout all of these phases? Effective use of resources. These childcare coordination teams were a critical part for our emergency response in COVID-19 across the state. And there's costs associated with operationalizing these emergency childcare systems. But it is these collaboration teams that put resources directly into our childcare programs to support staff, coordinate enrollment, parent support. We had mental health consultation to provide trauma-focused practices in the classroom. Local programs here are really struggling to operate. Staff are showing signs of burnout earlier. Children have increased anxiety. And you remember earlier, our childcare workers are paid less than $10 an hour. There are no margins of error in many childcare and after-school time budgets under normal circumstances. And so now on top of this, with the COVID problem, we're seeing a difficulty in these programs continuing to operate. Some of our K-8 programs and summer camps here in Gallatin County are talking about the cost of care is doubling. So it's clear that we cannot operate in a detached mode like we're used to, or these programs will close permanently. Public health outcomes. It's important, if every program and family is left alone to make plans, careful separation logistics in each program or school district will not be worth it. If a child has to attend a half-day class in school and then an after-school program and then at their family childcare provider, that's 3 separate classrooms to meet the needs of that working family, 3 separate classrooms to shut down if one child tests positive. It's possible that a coordinated referral or collaboration group can support more small, consistent groups that transition from school to out of school time, or a childcare provider that can be that bridge of public-private partnerships. In the next slide, we're going to talk about asset mapping. Knowing your individual community assets. I know this seems like really common sense, but in emergency, it can be kind of hard to remember to ask first, who else should be at the table? How can we build on existing programs? Your business community. These can be valuable community experts, even though they're not the traditional early childhood. So look for people outside of your area of expertise to find those new angles at discerning future opportunities. Maybe it's a communication team at your local business chamber who can design a better message to help reassure families. Maybe there's a business provider who can provide tutoring for parents on the work site to help them meet that deadline or attend a meeting that's in a COVID-safe way. Maybe businesses can provide nanny care for temporary relief or support for the families that work for them. Other groups that you should include, each community has a local Best Beginning Scholarship. And this last year, they just spent a year on a statewide strategic planning grant that informed them on data, resources, strengths and weaknesses of your specific community and your specific childcare systems. It's really important to get them involved. Of course, after school needs to be at the table. They're trained staff that provide enrichment supports with many school districts and in partnership with school districts already. They've mobilized all these years before, as Lori said, to keep kids safe while parents finish the work and close that learning gap with additional educational supports. It's important to get them on your team. And there's a lot of other groups as well, and those are just the two that I'm going to highlight there. Under facilities, COVID requires fewer kids per classroom, which means we need more real estate to keep up with this demand. In Gallatin County, rent is very expensive, but it's not much different across the state. Is there a way to offer empty office spaces or buildings for temporary childcare programs? Can your local after-school program use a classroom for a full 10-hour day program to ensure that support that we talked about for essential workers? How do property owners, if you own a building, make sure that the childcare programs currently in your building stay during this time? Sources of support. Parental stress is super high. Most of these organizations, after school programs and summer camps, are getting a ton of calls, asking questions, trying to figure out their plan, wanting to talk about health and safety concern, needing temporary breaks because they've been with their kids for over 20 weeks, 24/7 without a break. Is there a way that groups like learning centers, museums, gyms, libraries, places that provide these indirect support services for families to be a part of that collective solution by providing maybe a half-day care for 1 week that's temporary for families, as an example. Supplies and funding. While this can be cost-effective or done cost-effectively, this cannot happen without resources. And later, Danica will talk about the estimated need, where those funds can be allocated, how it can be distributed, and you'll hear that later. Volunteers. How do we get more person power to expand our current programs? Is that recruiting more mentors for an organization like in our community called Thrive, who does CAT mentorship programs? Can we recruit retired teachers to volunteer for coaching? Are there tech companies that can offer services? Are there businesses that can pay their employees to tutor 1 hour a week? Just all kinds of solutions where it's not providing direct care services, but support services to help with keeping these programs running. Let's talk about specific types of solutions. This list is a mix of supports within licensed childcare, after-school programs, and just really out-of-the-box systems. I bet you've already heard about some of these solutions popping up in your community. They're not completely unique, and there's definitely not a menu to choose from, because you really can't skip that earlier piece of coordination, equity, effectiveness, and public outcomes. Laying those out first will really help you decide how to use these next pieces. It's also important to remember, like, parents aren't waiting for schools to decide. They're already working on these solutions. There are Facebook groups, there are communities jumping in, and this planning should not be done in isolation. And if we as a community do not create a coordinated support, what will happen are the families with means will be the only ones with the ability to organize some of these childcare solutions. A bubble is one of these options, and this is helping like two families who choose to self-isolate together to share those resources in childcare and education needs. A co-op is similar, but it looks a little bit different. It requires a minimum of 5 adults, and this group self-isolates together. They're mostly doing online schooling. Each adult or caretaker is going to be responsible for 1 weekday where they take all the children to complete online schooling lessons, activities, and childcare for that day. That's obviously a great option for many families, but it's not an option for, say, the single parent physician assistant in my town who works 10-hour day shifts. So what would it look like to create a coordination team that can ensure those without resources and time or education can provide other options for like that single mom I talked about? There's a couple of other options here, and we can talk about those more and your community is probably already working on these, but another piece to remember is that when these health concerns were up against small group size and flexible hours and that trusting relationship that is the hallmark of family and group providers are really attractive right now. How can we create more of these facilities so we don't take away the rare slots for 0 to 5-year-olds with elementary students? This is specifically important for both COVID-related care, but also a critical component for economic recovery. On the next slide, this is an organizational chart that's that'll show you how a coordination team can look like, what this can look like across the state. And I won't go into detail here, but this will be a slide you can take home on how this interacts within the community systems. Great. Well, I really appreciate the time here, and I will pass this back to Sarah Corbley. Thanks.
All right. Thank you, Sarah Crum. All right. So that's just an example of obviously what some communities have been working on. We know there are obviously going to be other things that have been happening, and we hope to capture some of that in our breakouts with our small groups. But first, we're going to talk about current resources. And Caitlin Jensen from 0 to 5 Montana and the Family Forward Initiative is going to present a little information about their work.
Great, thank you so much, Sarah. So again, I'm here to provide an update on a few additional resources. One resource I'm really excited to share is the Family Forward Montana Initiative. This work was spearheaded through a National Governors Association grant to help address childcare workforce policy solutions, and continues to be a coordinated effort with private and public partners from across state government, including but not exclusive to the Office of Governor, the Early Childhood Services Bureau, DPHHS, the Department of Labor, and several partner organizations, including the Child Care Resource and Referral Network, Funders for Montana's Children, business leaders, local and state chambers, and of course, our early childhood community leaders across the state. As Megan mentioned, the work earlier in the presentation, the work to address childcare as a workforce issue started prior to COVID, but COVID has only exacerbated these challenges. And we're all really committed to continuing the efforts that started before COVID and to continue to work in collaboration and coordination through cross-sector partnerships to elevate local and statewide solutions. So as you can tell from this slide that's currently up, this is really a first go at a series of policies and practices that we've outlined as solutions that can really help support employers as they're looking for ways to help implement more family-friendly policies within their current place of employment. And so this is continuing to be built out, and we welcome any additional partnerships into this work. We're targeting for a launch date in the fall of 2020 to really build out more resources and policies. We have a kind of a draft website you're more than welcome to go and check out called Family Forward, well, www.familyforwardmt.com. And really the goals of this initiative are to help and connect employers with community partners and resources, to elevate family-friendly policies and recognize employers who've implemented some of these policies. And then on the website, we really want to be able to provide more resources and examples such as what's included within these different tiers around flexible work scheduling, telework, on-site childcare, and cooperative models that really aim to build more of a sustainable structure within communities. And as you heard from just now with Sarah, there's so much great work already happening and underway in communities across the state. And so the opportunity to really help connect some of these resources and solutions is what we're hoping to do through this platform.
Thank you.
This slide also shows the different types of, oh, sorry, just one more, the different types of policy solutions. I'll come back to that in just 1 second. But this is also tiering that was used for a recent workforce survey. And so we're really trying to align and build a strong foundation for this work as we move ahead. Okay, now you can go to the next slide. So the other resource we wanted to share is a series of toolkits and COVID-related resources that we have built out onto the 0 to 5 web page. And so there's a specific page, as you'll see here at the bottom of the slide, you can go to, and we built a lot of these based out of a family impact survey that we conducted back in April, kind of early on in these stages. I see Erin also put a link into the chat box so you can access it there. And we're in the process of building out another page related to this to help support community planning, especially as school districts are looking to help support these planning processes. So it's a lot of the work that's happened through this VOAD collaboration. And so you'll see some of those resources that have been created through the Office of Public Instruction and the Office of Governor to support school reopening. So as more toolkits and communities are working in partnership, we hope to have a space to be able to access and learn more. Thank you.
Thank you, Caitlin. So we had hoped to have a minute to talk about others out there who might have things going on, but we're running short on time. So if you are out there thinking, you know, we're doing this, or we're connecting with this business, or we're a group that's working on this issue, we would love for you to put that in the chat box. So as a group who's participating in the summit, people can be aware of the other work that's going on, and hopefully these efforts can all stay coordinated, because it's a big issue to solve, and the more people that can come together and work on it in coordination, the better. So at this point, I'm going to turn it over to Danica Jameson from the Greater Gallatin United Way, and she's going to talk a little bit about funding and some of the ways they have thought about addressing some of the funding shortfalls created by COVID that you've heard about already. So Danica.
Thank you, Sarah. As we were going through these presentations, I just want you to know I believe I'm the last presenter before we break out into breakout groups. So I was going to invite you while I speak for a few minutes to do a little stretching. We've already been sitting for almost an hour, and we're going to be diving into breakout groups. So feel free to move around while I present a few numbers here. As a provider of after-school programming, which sometimes involves full-day care, as when we partnered with the Gallatin Valley YMCA to provide emergency childcare for a 3-month period during COVID-19. We were really fortunate to receive some CARES Act funding through the Child Care Development Block Grant, CCDBG, through the Montana Department of Public Health and Human Services. And this is just a slide. I won't go into the details here, but we wanted to give it to you for a reference point to let you know specifically how $10.1 million was allocated throughout the state to support childcare and out-of-school time providers who are providing emergency childcare and for Best Beginning scholarships. Really key that this funding came in. It was, I think, well thought out on how to distribute it. Some of the challenges for us with the funding, as there are usually challenges around funding, included just most of us would have needed the funding a little bit earlier to have a greater peace of mind, and also that the funding amounts, particularly for the licensed child care providers, were great, but probably not adequate to meet some of the losses. As you saw in a slide from the survey, the average loss was about $34,000 so far for a child care provider. And I specifically know we have one on our call who used up almost all of their reserves during this time period. I believe it was about $40,000 to $50,000 of reserves. And so to receive $8,000 in the first round and another $5,500, super helpful, but many are experiencing losses. Another example, as an out-of-school time provider, we have about 100 staff members that serve in 30 programs across a 4-county area. And at about 11 of those sites, they continue to do some services. And even while we did not have an active program going, so we weren't collecting parent fees, but the staff were drawing on their annual leave, personal leave, sick leave, and ended up costing quite a lot to pay for their staffing time, which was helpful to be able to maintain their livelihood during that very stressful time, but we didn't have any parent fees to recoup. And because they are not on our payroll at United Way, but are on school district payroll, we weren't able to get PPP for them. So we are facing, just as an example, a $105,000 loss for the Bozeman School District around how to pay those staff members. So just an example of how sometimes the federal funding that comes through absolutely is essential. For example, we did receive an emergency pop-up program funding of $90,000 that covered our costs for that 3-month emergency childcare program. However, there was some lack of flexibility so that the licensed childcare providers who were providing the emergency care for the 0 to 5-year-olds weren't eligible to receive part of that funding. So just a little bit of an example of some of the challenges around funding and policy and flexibility around that. Super grateful for what we were able to receive and feeling uncertain right now about how to move forward. Next slide is my final slide, and I just wanted to give you an example of what some of those funding needs are very specifically. You've heard of some of them. In order to keep the transmission risks of COVID-19 low, we need to have small groups of children with adult teachers, and that means we need more teachers. So in the past, if we could have 18, 16 students to an after-school staff member, we now need to have 10 or 9 students to 1 just to make it safer. One of the things that we've found is that a lot of staff have a lot of fear around serving in this arena. They are at high risk and deserve hazard pay. And it's necessary to have hazard pay offered in order to retain them. We look at city employees across the country and other government employees requesting hazard pay for picking up trash and recycling services and many other roles that put them at risk in the community. And certainly childcare is one of those. Many of our childcare staff across the state do not have health insurance, paid sick leave, or paid time off. And so that is a really critical need right now as you see them serving in a high risk situation, maybe getting sick and not have the resources they need to take care of their health. Substitute staff on call would be helpful just because as people become sick, we experienced this, Karen Dakota's on our call today. We get calls almost regularly, almost every morning saying someone can't come in today. And so just needing to have more funding available to have substitute staff on call. Very essential to have the behavioral health consultant. We discovered that staff really need someone to talk to about the challenges that they're seeing, how to help families who are really struggling with the stresses that they're experiencing, and just to help the young people who are coming into the programs adjust to a very different childcare environment than they've ever experienced before. Masks, new staff, new protocols, how to play, not to play. It's very stressful for young children. Additional costs are here on the right. Some of them are much more obvious as we need to have social distancing, more space is needed. Sometimes that includes more costs for space. Training and support for staff, sanitation and personal protective equipment. The administrative costs of just building new infrastructure to get these programs going or to revamp programs. Remote learning needs also came up and maybe even more important this fall as we look to filling in days that schools are not open and helping students continue their curriculum and education. And then most importantly, families of kindergarten through 8th graders or older have not prepared personal budgets to be able to provide funding for extra out of school time care. And so as we look at this need, they may be already covering 0 to 5-year-old care, and now they are on top of that needing to figure out how to find care and pay for it for their kindergarten through 5th, 6th, 7th, 8th graders. And so we see a great need for funding to make sure that programs can be accessible to families regardless of their ability to pay. So that's a little bit about funding. When we look at what was distributed already, the 10.1 million, and that covered some of the needs for 3 months, it's easy to see how quickly the cost can climb to 50 million when you're looking at a year possibly of needing to find funding. So definitely beyond what a local community or single program can do on its own, and looking for some ideas in this space from you about how we might be able to consider meeting some of these funding needs moving forward. Thank you.
Thank you, Danica. Okay, so we've reached the point in the summit where we're hoping to hear from you now that you've heard from everyone on our agenda. Just next slide, Amber. I think at this point, in terms of a large group, hopefully you guys are still watching this window on your computer and engaged, and if you have anything that's burning that you want to share or want to speak, we just wanted to take a few minutes and have time as a group to reflect before we go into small groups. And in particular, you know, is what you're hearing consistent with what you're seeing? Are the assumptions of this problem correct that people have presented? Is there anything major that's been missed, or are there any areas that people feel, you know, that's just not right, I disagree, and I want to tell you why? Because that's how this group has functioned since the beginning. It's a great group, and we're really interested in anything that anyone feels like they want to share with a large group, if there is anything. And if you want to raise your hand, then someone is out there watching for you and will call on you. All right. Well, if no one has anything, then I guess we will take that as a sign that maybe what the folks have presented is mostly accurate, and people agree and are willing to have some small group discussions on it. So now I would go to the next slide. We're going to break you into Zoom small groups, and then we're going to ask you to choose a facilitator who can report out at the end of our small groups, as well as a note taker. There is a shared Google Doc. You can take your notes in whatever format you want in your group, but we ask that it at least get cut and paste into this Google Doc so that we can keep track of all the information that is shared, as well as a timekeeper. So here we've got an example of that Google Doc and the questions to talk about in your small groups. So there should be a link in the chat box to that that will pop up. If it hasn't yet, we'll send it out. So once you get into your small groups, we're hoping that you will all share out what, how do you see yourself or your organization connected to the problem and the solution? Can you help us further define or fill in the gaps on the challenges? Further identify solutions, ideas, or supportive roles that may have been missed or that need to be considered. And then what do you see as the next steps that should or need to happen? And we are hoping that your small group facilitators will elicit that information from each of the participants and take notes, obviously, as a note taker, and then we will share out as a large group. So we're going to be in breakout sessions about a half an hour. You're going to be in there with, we estimate about, I'm just going to round it to 8. So you're going to have to keep things moving, but we really do want to give you time to share, and we look forward to seeing you all back here in about 30 minutes. All right, welcome back. I see we've lost a few participants and we're still gaining some. Everybody mute yourself now that we're back in our big group together. I hope everyone had a good breakout session. I know our group had a great discussion, and so we are going to just take a break or a few moments to let each group sort of share out. If you are one of those people that want to share your own feelings, or you're willing to answer these questions in the chat box as well, if you don't have a chance to share what matters most to you, what you're going to walk away with that you feel was worthwhile, or solutions, please feel free to chat those. But I am going to ask each group facilitator to also say a few things. So group number 1, is there someone who is willing or who will speak for you?
Sure, that's this is Amber. I was in group 1. We had a good mix of representation of care providers, organizations, and business. And we talked a lot about various resources that we've come across that could help support providers and different people facing this issue. There was a lot of notes on actual links to reports and resources, so I tried to capture a lot of that in the notes, which will be shared to all. There was a consensus around the need for better collaboration and around PPE and some creative solutions around how businesses, particularly in Montana, that are stepping up to the plate, and how that information can be more widely distributed. There also was some very interesting conversation around slight tweaks to licensing requirements, and that would allow for more funding for the better the scholarship, Best Beginning Scholarship around after school care. And again, I tried to capture those notes, but it sounds like there's some easy tweaks that would help collaboration and improve access to care.
Great. Thank you. And thank you for staying to your 2 minutes. We've got about 9 groups. So group number 2.
Bree actually did our notes, but I'm going to do my best to give a quick relay. We also had a good diverse group, and a couple of us also took the opportunity to discuss our professional roles versus our parent roles and how those work together and sometimes didn't. We talked about the providers. One of our group members is a provider that experienced an incredible reduction in staff that is really tightly linked with the school systems, and is trying to navigate what they'll do, knowing that they will have to respond after the school district chooses their response. They had some great numbers that they were willing to share. We also talked about collaboration. At the very end, we talked a little bit about the encouragement that we're seeing in bipartisan support of the efforts that around keeping families healthy, and around improving funding availability and access to that funding, and that we also appreciate that decisions need to be made at the local level, because in Montana we are a very diverse, while rural, diverse group, and that allowing school districts and counties to make those decisions gives a step up for collaboration and engagement. We talked a little bit about research as well, and trying to close the gaps in the research that's happening, that there are providers and parents and probably even businesses that are feeling a little surveyed out, but may not be getting the results of the surveys that they're participating and volunteering their time for, that they're not hearing back on what the results are and what those next steps are. Lots more notes. Bree did a great job on notes.
Great. Thank you so much, Ashley. All right. Group number 3. Who's going to speak for you?
This is Kevin. Speaking for group 3. We took a lot of notes. Again, very diverse group, different levels and different entities. Pretty good representation. We talked about a wide variety of challenges that are fit. You know, I mean, we had enough challenges going on pre-COVID, let alone what that's done to funding and all kinds of other dynamics. Talked about collaborating with schools, school districts, and you know, really that's a great concept, but it's going to look so different for each community around the state, different needs, different challenges. So it's kind of tough to come up with one big master plan for that. But also the importance of collaborations between childcare providers, summer programs. That's one thing that we're experiencing and really trying to move forward is getting our summer program directors to share lessons learned with the school districts. Those summer programs were the guinea pigs this summer of kids coming out of isolation and interacting with kids, let alone mask use and all that. So we're trying to capitalize on that lesson learned by that big group of summer care providers. We also talked about economic concerns and how our communities and our economies are going to move forward based on the foundation of good, solid, dependable, safe childcare. That's how parents can get back to work. That's an obvious one, but you know, it's certainly worth talking through. Talked about surveys that have gone out about childcare to families. And it was interesting, the survey wrapped up around March. And so we had the discussion of how interesting would that be for the next quarter after that, or even the year after that. So that sounds like that will happen again. And then the shift of, well, one of the dynamics of a lot of the care providers are close to or in that vulnerable age group, and how they've had to balance that decision making between, do I maintain making a living or do I put myself at risk? What the priorities are there. So we kind of went all over the place, but it was a really good discussion.
Well, great. And there are a lot of challenges. So thank you for your input. Group number 4. I think I nominated Patty from our group.
Is that us? Are we 4?
We're 4. Thank you.
Oh, okay. I didn't know what number we were. Well, let's see if I can report out. I didn't take the notes, but we had somebody very competent to do the notes. I just talked a little bit. So one of the things that we were pretty excited to share and to hear is that little kids, that's a broad statement, but little kids are doing really well and are very resilient in terms of wearing masks. And I wholeheartedly agree with that almost always children lead the way and are able to keep us adults in line. So really happy to hear that from somebody that's actually working with kids. So that was the best part of our conversation, was that our children will take care of us in the direction that we're going, and with a little bit of modeling and some positive attitude, we're going to get there. Beyond that, we talked a little bit about being flat-footed. I would agree with some of what else was said, is that we have talked about and need to prepare ourselves. Thought we had, and maybe we haven't, as a nation, as a state, as a profession, to prepare ourselves for substitute pools, to prepare ourselves for licensing that accommodates and reacts to the needs, whether it's a school district or whether it's childcare or school age groups, and how we might be able to do that. We talked a little bit about what an appropriate expectation is of response for both money and support from the federal government and from the state government, recognizing that we all, irregardless of what organization you represent, wanted to do more, needed to do more, and yet we all have structures and processes that we have to respect in order to get to a good place. And when things are changing as quickly as they are, that communication and quick reaction is not what we need. And even though we want it, we all want it, it doesn't bode well for us in the long run. That said, I would like to let you know a couple things that are coming down from our office. As of August 1st, there's 2 new policies that are coming out. We recognize that we did a 3-month Save Ourselves full authorization for Best Beginning Scholarship, which is the support for low-income working families for Best Beginning Scholarships. We did full authorization. So if a child is in your program but not attending for whatever reason it is, this is not our policy, but we are putting the policy back into effect that we had for 3 months that will pay for full authorization. That'll start August 1st. We have some anecdotal stories. We have a lot of providers talking to us. Tribal reservations, borders that are closing and only having one person in a car that's coming out. So therefore the children can't go to the childcare program on the other side of that border. And so that provider can't care for those children that can't get to them. What do we do? And so the many stories. And so that full authorization will cover that slot, whether that family is there for whatever reason. We think that will be helpful. We don't have an end date on that. We're going to put that out there. The other thing that's going to happen, we think might help, particularly this group, is when we get our market rate survey. 3 years ago, we received that, and we set reimbursement rates for children in programs for the Best Beginning Scholarship. We set those rates for school age kids knowing that their ratio was for a certain age group, that their time of day was specific to school age. Now we see that changing. So we're, of course, we're going to react to that change. So school age rate reimbursement will now go to the same rate as children aged 3 to 5. That's about a 33% increase in that reimbursement. So, and I would give you those rates right now, but they're all different depending on whether that's a center, a group home, a family home, a relative care, a family, friend, or neighbor. So those rates will increase on August 1st with, again, no end date at this point. So that the reimbursement rate for those kids that are in programs full days will reflect that amount. So I'm actually going to talk to our R&Rs this afternoon to tell them all about those new policies, and then that communication will go out tomorrow. But those are two policies we think might support providers and families. The other thing I know that's coming out, and it's not mine to announce, it's at a governor's and director's office level, but what I do know and what I can say is that there are supports coming out for out-of-school time care. I would expect that that announcement will come out in the form of grants here in the next week, maybe 2, that will be, I think, substantial to be able to support programs who are serving school-age kids. Again, things take time to put together and to get the structure ready to roll that out. These will not be CCDF monies. Those are all used up. That 10 million went really fast. I hope that was really useful in some ways. I'm recognizing it was not enough. But that announcement will come out, and the specifics and the criteria for that will come out. And I think it will be helpful to out-of-school time programs.
Thank you, Patty. And thanks for a little positive news. I do think, you know, people will have to be ready to obviously use the money without knowing certainly what it will look like. And so the challenges will remain. Next, let's hear from Group 5. We are down to about 7 minutes. So if you can limit it to like your highlights or your best pieces and stay at about a minute, that would be great.
Yeah, hey, I'll take a Group 5. I just want to honor one of the things that came through and I think resonates for everyone, that folks are tired and just want to honor it's hard. And that I think one of the themes we heard is it's hard professionally and personally, and those are often weaving together for folks. So just lifting that up, and that coordination's a little tricky right now, being in this virtual space. But some good flags for things as we think about solutions moving forward, being mindful of odd hour care that families need, particularly on the front lines. Your person who's stocking the shelves at Walmart in the middle of the night, that person might need care as well. Also keeping in mind youth voice and keeping in mind that families still need connection. So one idea was that even as we're able to utilize outdoor spaces, not just utilizing them for youth services, but also opportunities to be able to connect with families and provide them with support as well. I will stop it there and move it on to the next.
Thank you. Group 6.
Hi, we were Group 6. We were very small. And the one thing I think I knew, but I also heard confirmed, is the fear of parents is really driving the decline in enrollment. And the decline in enrollment is driving the decline in revenue, which is, it's just this cascading effect. One of the things that we talked about is the real need to partner with health professionals in order to start helping parents feel more comfortable about enrolling their kids in programs. We know that kids are happier in programs and do better. And so how do we as entities and healthcare workers and health departments start putting out a message? And that's a big can of worms, but we're going to continue to face the same problems if parents are reluctant to put their kids in programs or childcare. The other thing we talked about is the unemployment benefits are very attractive right now. There is talk about continuing those, and retaining staffing for childcare centers is a huge issue when it is about when there's very attractive benefits to unemployment. And that is what I'm going to say were our high points: education from healthcare professionals, unemployment benefits, skewing staffing, and then the fear of parents.
Thank you. Those are very important points. Okay, 7, group 7.
That would be our group. We had a licensed care, LCPC in our group, and a counselor and several child care providers, and a hospital, state level hospital support person. So some interesting perspectives. Definitely talked a lot about parent stress and staff stress and the need for continued behavioral health support. Ideally, some kinds of groups or access for families and providers for behavioral health consultation, and that funding for that would be helpful. One of our childcare providers in the group talked about how it's just hard to get gloves at some point and masks, and the hospital provider said, oh, it's been hard for us too in the hospital. Maybe we can help with that. So just really wanting to just emphasize that some of these things like sanitation supplies and PPE, boy, it'd be great if there was some state level structure for that, where individual childcare providers aren't having to struggle to find it all on their own, and it's just kind of done for them, and here's your supply that you need. Also talked about just the question about the schools and going back to school and that level of uncertainty, and really spent some time talking about some of the financial struggles that our childcare providers are having, losing almost all of their $55,000 in reserve, feeling lucky to have had a reserve, but now entering the month of August where that will be completely gone, and uncertain about keeping doors open without continued financial support for childcare programs.
All right. Thank you, Danica. Group 8. Do we have a group 8?
We do. Let's see, I guess I can share out. So we talked a lot about how this needs to be addressed at a community level, and that it needs to be seen as truly essential. So one of the analogies that was made was we don't pay firefighters according to the number of fires that they respond to. That we need to see this as an integral, necessary part of our community. I think that was the biggest thing that stuck out, and that those conversations are starting to happen, and we're optimistic about that.
Right, we need a fire station even if we have less fires. Yeah. Good point. Okay, group number 9.
Hi, so we covered a few things. We started out by talking about behavioral health issues and the stress on parents and on kids in a really uncertain world. And a lot of the conversation also had to do with the fracturing between the things that are going to be happening because of school closures or changes in the school environment, and how kids are going to keep safe and be educated in the new environments that they find themselves in, while being concerned about their protection and the potential spread of COVID. So we also talked about the business impacts of across the state related to parents not being able to work, and because of childcare related issues. And the Montana Department of Chamber of Commerce did some survey of their businesses in the fall, which we want to combine with some of the work on the survey that we did in Enhance MT. There's a lot of concern about COAD members and their kids. You know, a lot of the essential workers and other people need a break, and they need to be able to find time to like reset themselves. Talk about kids being in smaller groups and keep coherence, especially when school facilities are not going to probably be the same as what they had been. A discussion about how childcare facilities are dropping out, and there's a reduction in how to deal with that. And so one of the suggestions was that there should be public funding to support childcare center slots for people, because there are a lot of people who just can't afford anything. And then finally, I promoted the idea that anybody that has suggestions that can help collectively the group of childcare providers, business and such, if they could send some information, we'll post it on enhancemt.org. That's it.
Thank you. Thank you all for doing that in a very timely and concise fashion. I know we're at 12. We're actually at 12:01. So I'm going to wrap this up, but I'm going to say this. To those of you who just joined us for today, I hope you learned a lot. I hope that in whatever form you can stay committed to this issue. For those of you who joined us today and are willing to continue to engage with the VOAD, we would love to have more engagement and ongoing work as a larger group to address these challenges and work to implement some of the solutions. Obviously, it's still a challenging time and we don't have an end in sight. So Megan's contact information is on the screen. We will also save the chat, be sending out the notes, be compiling all the information we got, and we will be back in touch with those of you who want to stay engaged and involved. And I honestly can't thank all of you enough for spending another 2 hours on your computer. I know that's a lot to ask. So on behalf of our kids, on behalf of our childcare providers, out of school time providers, thank you very much, and have a wonderful rest of your day.
Thanks very much.
Thank you all.